I am Samanta Mariani, and I'm now a Chancellor Fellow and a John Goldman Leukaemia UK Fellow, and I do research on leukemia and steady-state hematopoiesis. I'm based at the University of Edinburgh. The main focus of my lab is trying to understand what's the relationship between immune cells and hematopoietic stem cells. So hematopoietic stem cells are the mothers, basically, of all the blood cells, and I'm interested to know what happens during their generation at embryonic level. So it can be that this generation of hematopoietic stem cells actually goes wrong at embryonic level, and then we can get infant leukemia. That is a specific kind of leukemia that affects infants that are younger than 1 year of age. So, and there are evidences that the immune cells, specifically a kind of immune cells that are called macrophages, can have a role in the development of leukemia in adults. And what I want to know now is to understand if these macrophages have a role also in infant leukemia. So if we can exploit their role and their function to find a new way to try new therapies for infant leukemia. The reason why I started doing hematological research is not really a happy reason. I had a friend when I was in the high school, and it was my best friend back then, who actually started suffering of chronic myeloid leukemia. And I was really involved. I mean, I was really close to him and, of course, to his family. Unfortunately, his story ended up not really well because he passed away. Because back then there was not yet, the like imatinib, that is a life-saving drug for chronic myeloid leukemia. But it was literally like a few months before this drug was approved by the FDA to be used in patients, but actually was not fast enough for him. So by then, when I saw that actually, the research was actually giving hope to other people, and I just decided, okay, I want to do my share on this. And then that's why I decided to start studying leukemia, and that's why I ended up here. This research is really important because we really need to continue working on it and finding new therapies, and until we beat blood cancer for good. I think that my work will make a difference to patients because what I hope to find is new cures for this disease. The side effects of chemotherapy in infants are way worse of the one that we actually get in adults. We really need new therapies to try to reduce the chemotherapy treatment by adding maybe other different drugs that can have less side effects. So my research would really positively impact the life of the patients if I succeed in doing so. I can, thanks to this fellowship, hire now a research technician who's going to help me in doing the research that is needed. And I really hope that, I already made an advance on what I want to do, so find a new cure for infant leukemia. So it was life-changing for my scientific career.